So today we're going to discuss a microhematocrit hematology method. In class, we have discussed what hematocrit actually is when it comes to laboratory testing in hematology. And hematocrit is basically the amount of red blood cells that are making up a person's blood in a given volume. Hematocrit is also referred to as the packed cell volume or the red cell volume. And today we have collected 2 capillary tubes containing whole blood from a fingerstick capillary blood collection. If you have not yet watched the video on proper capillary blood collection, please do so before continuing in this video. So ideally, when we're going to perform a hematocrit test in hematology by this method, we're going to want 2 properly filled microhematocrit tubes, and we want those to be the pre-sealed kind or have them sealed on one end, and they can be either a heparinized capillary tube to prevent clotting, or we can use a non-additive capillary tube. Tubes should be filled roughly 3/4 full, and ideally also have no bubbles within the sample space inside of the tubes. In order to find out how much of that patient's blood volume is in fact packed cells or red blood cells, we do have to pack the red blood cells to the bottom of this capillary tube using a special centrifuge, the microhematocrit centrifuge. So this centrifuge has a bucket that is specially designed with spaces for the capillary tubes to fit. Again, we have to balance our samples in the centrifuge just as we would in a normal centrifuge by placing them opposite of one another inside of the basket. We also want to place the sealed end of the capillary tube toward the outside. Once we've done that, we can place the lid on and start the centrifuge spinning for a time of 5 minutes. These centrifuges are preset to spin at the proper revolutions per minute in order to separate the red blood cells without damaging them inside of the capillary tube. Once that 5-minute spin has ended, we will have 2 capillary samples that have been separated. You can see the red blood cells at the bottom near the sealed end of the tube. There is the plasma or serum portion, the liquid portion of the blood at the top. And if you look closely, you can see a small area of buffy coat. So we're going to take these samples that have been separated and we're going to read them on a special device that will help us determine the percent of that patient's blood sample that is, in fact, packed red blood cells or hematocrit. And to do that, we use the microcapillary reader. This device is designed that when we place our capillary sample into the reading area, we will be able to tell how much of that sample is actually packed cells. So we're going to place our sample into the reading space, and in this case, we're going to put the sealed end toward the middle or center of this device. The 100% is falling right now under the reading line. There's a red reading line, and it is right now at 100%. But in order to actually get the percent packed cell volume for our patient, we are going to have to turn the dial until the curved black line in the center of the reading device falls right where the red blood cells stop in the tube. When you're performing this reading, you do want to be directly above so that you're looking directly downward onto that black space or that black line, and you do not want to include the buffy coat in the reading. So you can line up the top edge of your packed red cells, and then you're going to read the number on the dial below the reading line. For my patient, I have 18. We always do a second tube, or we do this test in duplicate, because we do want to make sure that we get 2 readings that are within 3% difference of one another for accuracy purposes. So the second tube on this patient is actually reading a bit higher. It is reading at 21. Now, as long as those two readings are close enough to one another, we can accept that test for microhematocrit. Let's try another patient. I have 2 spun capillary tubes on this patient as well, and I'm going to place the first one into the reading device and turn the dial until the black line is bisecting or going through the top of the red blood cells, and I'm getting a reading of 29. With my second tube on this patient, I'm getting a reading of 30. Those two results are definitely close enough to one another to be considered accurate, and I would report 29.5 in my patient's result to the physician. After having watched this video, please review the normal ranges for patients for packed cell volume or microhematocrit and determine whether my patient result of 29.5 falls within that normal range.